Welcome to Camping with Jersey Joe. It's been a couple of months since I recorded a video. I am in Altoona, Iowa at Adventureland Campground where I'll be work camping for the summer. Beautiful place, beautiful area. I'm also here to take care of some medical needs, and I'll get into a very important one in a bit. But the reason for the work camping job is that after spending the winter at Quartzsite in one spot, or a couple of spots actually, I did move for a few weeks, and not having to move around a lot. The idea of moving around in the summer months and on federal land, you do have to move roughly every 14 days. That was not something I wanted to do, so I started investigating work camping, looking at camp hosting jobs at federal parks, and I did have a few offers. But then I talked to a recruiter at the Quartzsite RV show from Adventureland, who happens to be my direct boss right now, and it sounded appealing. You come out here, you get hookups. I've been here since April 8th. Hookups from day one. Started working about a month and a half ago, and now we're in full swing. The park is open just about every day, and it's turning out to be very enjoyable. I'm having a great time, meeting a lot of good people. It's a welcome change, something a little bit different. I'm out here with the pups right now. There's nobody walking by, so they're not making a ruckus up. But this area is beautiful out here. The campground is very nice. The amusement park is awesome. And right across the street is a combination casino and horse race track, which I haven't been able to visit yet. And the reason for that is medical. I have been wearing a catheter since February full time. And my catheter problems began in October driving to Quartzsite. I had to go stop at a clinic to get an emergency catheter treatment. It wasn't until February that I was told that I had to wear one full time, and I would have to get a surgical procedure done. And I couldn't make an appointment. Called Lake Havasu, called Yuma. They were 6 months, 8 months out. The hospital in Blythe, California recommended I go to Palm Springs, California, which is for me 3 hours away from where I was. And I said that's not going to happen, so I had to delay. And then I realized it's one of the reasons I took the position here, but now I plan on coming back if I can. And I made an appointment here. So I got here on the 8th of April. On the 10th, I was in the doctor's office, and luckily for me, because I had been doing some research, a lot of the prostate procedures available, for the most part, if you have an enlarged prostate, and mine was very enlarged, a lot of these procedures that have been in practice for quite a while are temporary at best, and you could be back in 3, 4, 5 years for another procedure. Well, at Broadlawns Medical Center here in Des Moines, they have one of the few doctors in the country that can perform the HOLEP procedures, HOLEP. That involves inserting a camera with a laser scope into your prostate, and basically, if you take an orange and you can insert a laser inside and just cut away all the meat and leave the core intact. Well, that's exactly what happened. They've done that. That happened yesterday. It was a one-day procedure in and out of the hospital. They put me to sleep. They did the work. I came out. I still have a catheter on. I will be removing it on Friday when I get out of work, and then for about a period of 1 to 3 months, I will probably have to wear depends, and in other words, adult diapers, because I have to retrain myself again to control my bladder, because it's been on automatic flow now since I've had the catheter in there full time. and I've already started doing exercises to hasten that process. Um, the bleeding is just about stopped, and that's just blood coming out. Um, Nothing to worry about. It's normal. There is no pain. The only discomfort I had was not in where the work was done, but where the catheter was inserted. That was very sore because they had put the equipment down there, so to speak, to clean out my prostate. But this procedure will probably last the rest of my life, which means I will not have to get anything done. I immediately stopped taking prostate medicine. The doctor told me I'm going to have to go and drop it off at a Walgreens because I had gone to Mexico to pick up quite a supply, figuring I'd be on it for quite a while. But now there's no more prostate medicines to take. It's been cleaned out. I'm looking forward to Friday taking out the catheter, then having to learn again on how to hold my urine, but at the same time, I'm going to be quite interested to see how the flow is, because it was very restricted before. I couldn't even get a couple of drops out, and then I'd be in extreme pain. Now, for any of you gentlemen out there that have prostate issues, get it looked at. I had a biopsy done last year, so it came back negative. It's not cancerous. There's only one small area where the biopsy couldn't reach, and they'll be testing that. But hopefully, God willing, I do not have any cancer. The prostate now is just a sac. The urethra is going through there, coming from the bladder. I have a very excellent chance of getting the leakage under control within 3 months. The only difference, and it's not, I don't even consider it to be a negative, is that sexually it doesn't affect your feeling, but you do, permanency is going to be there in the what they call retrograde ejaculation, which means when I feel satisfied, and those urges will still be there, but instead of coming out one way, it goes the other, and it's going to go into the bladder. That is permanent. But I'm 66 years old. I don't think I'll be having any more kids, and so I'm good. I'll still feel normal sensation. So if any man is thinking about it, or you're in trouble, you don't have to get the prostate taken out unless there's another medical issue underlying there. But I still got everything working. It's just that the flow is going to go in the opposite direction, and I can live with that. It's weird now because I've been doing this since February, and that's not a long time, but it is a long time if you have to deal with the sac every single day. And then you have problems with the bags disconnecting, this, that, and the other. So I'll be extremely happy when this thing comes out. I'm very happy right now. This is the first time I have been, I wasn't depressed, but just a little bit apprehensive about where everything was going, because everything was taking so long to take place. But now that it's done, I'm completely at peace. Looking forward to, once I'm totally healed in a couple of months, I plan on going to take advantage and see what's around here, and start living life again. I have basically been here. I haven't left other than to go working, go shopping. I stay at the trailer because who wants to go out with a bag taped on your leg? So that's not a thing for me. But it's imperative, guys. Check your prostate. If you have any kind of problem with your urine flow, anything at all, you notice anything, burning sensation, You got to push it out. It's not coming out. Immediately go see a doctor. When I asked the doctors when I first started getting tested a couple of years ago, I said, "What is it? What did I do wrong?" They go, "Nothing." So I believe a lot has to do with the diet we have in this country. And I've been on carnivore now for a few years, lost a lot of weight, dropped a lot of meds, no more CPAP machine. But I believe that my prostate was so enlarged that the carnivore diet could not shrink it. Now, as far as enlarged, I asked the surgeon yesterday when he came in to see me before I checked out. I said, well, he explained the process to me, and they have a machine where all the material comes out with the blood and the meat that's minced up in the bladder with a special tool, and then they separate it. So I go, well, how much did you take out? He goes, we took out 3 containers, whatever their size their container was. And I asked him, well, how many containers do you usually take out of a large prostate? He goes, 1. They took 3. I must have had a softball down there. Now, mind you, the prostate is normally the size of a walnut. So it was pretty, so you can imagine there was no flow coming through at all. They tried to have me use self catheters. That didn't work, because the minute I started to feel pain when I was doing it, I stopped when I saw some blood, and I went right back to the hospital, had a catheter installed. But my problems were so bad that I would have probably had to self-catheter myself maybe 5, 6, 7 times a day. So that was not even a solution. But today is a great day. You know, it's... I'm looking forward to everything, and then finally I've been sitting here for a couple months, working, obviously, meeting some good people, but I've just been stuck in limbo, because at the back of my mind it was always the catheter thing. You know, I got to watch it. A couple of times the bag came away from the catheter itself, and there I am. I have to run to the bathroom and plug it up. So from what I've read, this is a permanent, good solution. The only negative is the retrograde ejaculation. I can live with that. And as I said, I got to retrain myself. It's almost like I'm a kid again, and learn how to control my bladder flow. And there are exercises to help me do that. But guys, get yourselves checked out. The prostate, while the cancer is very slow growing, unlike in some other people recently in the news, but it takes a long time. But the symptoms are there, and it's not always cancer. It can always just be like what I had, which is just an over-enlarged prostate. I can only imagine how big it was. And but that part is over. That part is over. It's a very, very good day. But what you want to do, HOLEP. That's an acronym. I don't remember the exact terminology, but it's HOLEP. Look it up on YouTube. They got videos from many doctors, also testimonials from patients that have done it, and one video which I saw the day before the surgery when it was an actual procedure. Can't unsee that one. I was already a little bit apprehensive when I went to the doctor when I saw this jackhammer going down the guy's Johnson. So anyway, I'm only kidding, guys. Not that big. Not a jackhammer. But anyway, just figured I'd let that. Oh, another thing I want to discuss. I got here, went to the doctor's, and I'm by myself. I did come with a friend of mine, but he's also working here, and we're working at an amusement park, and the hours are what the hours are. You know, we have to take care of the guests. Just like when I was a chauffeur, you got to work when you have the business. So I put in for the time off, and I said to them, well, you know, I'm not going to drive here because I know I can't drive when I leave. I'm under anesthesia. But I said I'll take an Uber back to the campground. Well, right away they said, well, we're not going to do the surgery. I said, okay, so what does a nomad like me do? Do we just wither and die? I mean, or how about other people that are elderly that have nobody? What do they do? So then they had me talking with a manager at the hospital. And I said, well, why can't I do it? And they go, well, because the Uber drivers are not medically trained. But if I could find an axe murderer living here at the campground with no insurance and no valid driver's license, but they had a cell phone that the nurse could call so they could pick me up after the procedure, no problem. Okay? They would let it get done. So I said, obviously, it's not a medical issue. It's probably more a liability insurance issue. Which if they had told me that from the jump, we live in a litigious society, so I get it. But the fact that they told me that it was because that there was no medical training, it was strictly BS. So, nomads, what you need to do, okay, take care of your medical. By the way, Medicare has been great. And I love the fact that I can go anywhere and get work done. And I've been happy with it so far. But do investigating. Don't depend on the hospitals looking at your point of view and letting you take an Uber or some other unconventional ride service. Even though Uber's not unconventional anymore. I was a chauffeur in Orlando and they destroyed my business. So I had to join them for a while before I started caregiving. But do your due diligence. Okay, just like we have a hard time with banks, insurance companies, and so forth, medical is no different. Okay, the world is not prepared for people that live on the road that may not have the resources of people that do. And even people that, I'm sure there's people here in Des Moines that, for whatever reason, whether they're elderly or not, they have nobody that can help them. What do they do? I don't know the answer to that, other than do your due diligence, take care of yourself. Anything pops up, try to handle it at once, if you can. Some people can't. For those of you about to get on Medicare, it's been nothing but a joy, much better than the Affordable Care Act that I had when I was a chauffeur. Much better treatment. Just about everybody takes it. I'm very satisfied with it. But that medical thing for nomads is a bit of a problem. Now, the easiest way to do that is to find somebody to travel with full time, but that's difficult because everybody's going in a different direction. And I know that's tougher, but if you do have something that's planned that you have to do medically, maybe you can arrange to have someone go with you. Maybe both of you can arrange to have your medical work done at the same time. I've already started the process to get my colonoscopy done while I'm here, which after this procedure is going to be a walk in the park. I had last had one 3 years ago. I was told back then I have to get it every 3 years instead of every 5. So I'm going to get that done while I'm here. I got to take the dogs to the vet, get their shots before we go back to quartzsite. But it's very serious, the medical issue, as far as being alone and not having anyone to help. They wanted to cancel the surgery right away, and which I couldn't let that happen. And I was lucky that Bill, my friend that we came from quartzsite together, he requested the same day off yesterday, and I was very fortunate that I did not have to stay overnight, because the HOLEP procedure, for the most part, most people go home same day, but there are some that do keep overnight. And I would imagine if they have a problem with the anesthesia, or if they get the procedure done late in the day, then you probably have to stay overnight. I am lucky in the fact I have no allergies. I don't have a problem when I'm put under. And I was back here at the trailer yesterday by 2:30 in the afternoon. A little groggy, a lot of discomfort, but again, not where they performed the HOLEP, but where the catheter entered, because it was very sore. Today, much better. Uh, Bleeding is down very low, so I already started my exercises, so it's all good. Anyway, let's see what else I wanted to discuss today. Anyway, let me talk about Des Moines a little bit. Des Moines is pretty cool. It reminds me of Jersey. A lot of the homes, it's just an older town, just like Jersey. And unlike Orlando, where I came from recently, and you have a whole section just built and designed in the same price range. You can drive down, see a row of houses that are middle income, and then right there's a mansion. And it's just like Jersey was. Houses built up where the basements are just above the sidewalk with earth around it. Same thing as I remember. I came here and I just wanted to Google, since my heritage is Puerto Rican, I wanted to see if there were any Puerto Rican restaurants here, and there's a ton of them. I thought I was going to be the only guy here. So anyway, I am going to cheat on my carnivore diet once my incontinence is taken care of. Once I get out of the depends, I'm going to take my buddy Bill and I'm going to have him eat some Puerto Rican food for the first time, and I'm going to break the carnivore diet. Haven't had rice and beans in about, 4 years. So I'll be ready for that. But I'm back. I did cheat on the carnivore when I was in quartzsite a little bit, and I'm getting back on it and starting to drop the weight again. I'm feeling better. The drinking, not that I drank a lot the last few years, but whatever, I'm drinking even less now because there's no appeal to it. I'm very conscious now of, my father had a stroke, had 2 strokes as a matter of fact. Well, I think maybe even a third. Right before he passed, I'm thinking that he had a stroke and we didn't realize it because he just kept smiling and not talking. But anyway, I'm trying to avoid all of that stuff. So with the carnivore diet, occasional glass of wine may occur, obviously, but as far as some people can do an everyday glass of wine. I had such a rich diet my whole life that maybe that's not a good idea. So, but carnivore's been good. If anybody's, and it's not only the weight loss, the health benefits are immense. Start watching videos. Dr. Sean Baker on YouTube. Dr. Berry on YouTube. These guys, they talk and it makes such common sense. For those of you guys and women that are around my age, we grew up, we didn't have a lot of these problems. What was autism? When we were kids, we weren't overweight. We got out of the house in the morning, didn't come back until dinner time, rode our bikes, did this, did that. But it's all the junk that's in these foods now. I remember when I was doing keto, and I know I'm all over the map here with this today, but this is my first video in a while, so I'm just letting it rip. But when I was on keto, and the reason I stopped keto, because you go to the store and you see some bread and it says keto. You read the carbs, you subtract the dietary fibers from the carbs. Oh great, this is low. But it's all bogus because they're putting chemicals in there. Not good. Anything now, even if you smoke cigarettes, which I used to, but I stopped 10 years ago. Besides the carcinogens that are in the tobacco itself from the earth, they're throwing all this junk in to keep you addicted. It's not the nicotine. So, I mean, it's just incredible the junk we eat. And the chemicals they put in the substances we have, the color dyes that they put in the foods that, I remember when I grew up, I mean, you have maybe a couple of different ice creams. Now you go to the store, there's a whole aisle full of ice cream, 50 different breads. Before we had 2 or 3. Same thing with cookies and cakes. And how are they selling them? They make them look appealing. How do you make them look appealing? Color. How do you add color? With chemicals. It's insane. The lotions we use, the stuff we brush our teeth with, it's just insane. The amount of chemicals. So I know that cutting down on that, I was heavy on the CPAP machine. I had I had COPD. Now it's been sitting in the back of my pickup truck for the last 2 years with all the filters, I guess now, which are probably no good, but doesn't matter. I don't need it. I don't wake up gagging in the middle of the night any longer. I just went and had my blood work done. All they found out was I have to go back on atorvastatin, 40 milligrams for my cholesterol. Well, and I know why that was, because I started cheating on the diet, or the lifestyle, I should say. If it wasn't, because the last time I had the blood work done in Orlando when I was full on carnivore, the blood work came back and the doctor couldn't yell at me, telling me that carnivore was bad for me, because everything came back in line. So what the blood work I just had done was my fault, because I got off the lifestyle. So I know it works. I was 280. I am now at 202. I was down to 189, so I'm going back down. I want to get back. I want to go to 160 is my goal. And I hope to hit that before I leave here at the end of October. So I plan on being here through the end of October, and then I'll make my way back down to Quartzsite, and then come back here again in the springtime, to get medical work done. But I am looking forward to going around. I want to get to that casino across the street, not to gamble, but there's a sign that's lit up and it says Surf and Turf, $30. And if any of you have been to casinos, especially in Jersey, used to go to AC all the time, and they had some mean buffets that didn't cost a lot. Same thing in Vegas, I guess. I've never been to Vegas. So I'm sure for $30 at that casino, that meal's got to be pretty good. So I'm looking forward to trying that, and maybe even trying to relive my Meadowlands days and maybe even bet on the thoroughbreds across the street. So anyway, guys, I apologize. I know this was all over the map. I had a little bit of an outline. Didn't work out as well as I thought, but listen, look at my happy camper. It's like, even though I still have a few months to go before it's totally fixed, I still feel that this was it. And that's, and even though my trouble started in October with the catheters, before that I knew I had trouble brewing, because I was on prostate medicine for 3 years before that. So this is, and in the back of your head, it's something I knew it, but I didn't want to face it. And every time I went to the doctor, everything I was talking about was based on avoiding the inevitable. But anyway, I'm glad I had the procedure done. In fact, they put me under. I said, I know I don't feel nothing. And I guess it was just hitting me. And then as soon as I woke up in recovery, I go, when are you guys going to start? And it was already like 4 hours later. Anyway, guys and gals, thank you for listening in. I plan on getting to a schedule. I'm going to photograph everything I do except in the park. I can't do that as an employee there. I can't do that, but I am going to start, once I can start exercising again, I'm going to start walking around the campground, taking the camera with me. I'll even take one of the 2 dogs. I can't walk both dogs at the same time. They'll wrap themselves around me. When I go to the casino across the street, when I go into Des Moines and start driving around and looking at the sights out there, I'm going to take you with me. And when I get to that restaurant for that arroz con gandules, some lechon, I'm going to bring you guys with me. Anyway, thanks for tuning into my video today. I want to bless all of you. Have a great day.